Hi, I'm Jennifer Kim from the Cancer Caring Center, and we have tonight we have Cognitive Toolbox with Marissa, and our topic is brain fog. So if you want to take it away, Marissa,
yes.
Get started.
All right. Okay, can everybody see? Everybody can see okay, I hope. So just as usual with our presentations, just to kind of put a little disclaimer out there, this presentation is not intended as any formal diagnostic or treatment for what we're going to discuss. But if you do have any symptoms related to any of the content of this presentation, or any other of the conditions that we might discuss or that you might have questions about, please be sure to consult your medical professionals. So this month, like Jen had mentioned, we're going to be talking a little bit about brain fog. It seems like this was one of the trends that's come up in the past few months, or we maybe even talked about it a little bit more specifically at last month's meeting. So we've touched on a lot of different aspects of cognition, and we decided that maybe it would be a good idea to talk about this fogginess that people experience. So we will start by talking about brain fog, and then kind of also end with an overview of cognition, cognitive therapy, and some things that can help. Okay. So brain fog, or if some of you might have called it a chemo brain, can be caused in a variety of different ways. It can be caused, actually, I found this statistic as well. I don't know how recent it is, but I actually found that there was 17 to 50% of female breast cancer survivors that experience brain fog. Some of these causes, and this can also occur in other diagnoses as well, different types of cancers. Some of the causes can be the chemotherapies themselves, the different treatments, the cancers themselves, which might depend a little bit on the origin of the tumor, if there's a tumor involved, and is there any metastasis to the brain. In those situations, you might experience some cognitive change or brain fog. One of the other, and then the last possible cause for brain fog would be some of our secondary medications that we might use as a result of cancer, chemotherapy, and radiation treatments. So for example, different pain medications may also have an impact. I wanted to add this link on here. I believe it's chemocare.org, and I can double check on that, but this was actually a website that was brought up in one of our prior meetings, and I have since found it very helpful, even as a clinician, to research some different medications that are used in chemotherapy, radiation, and cancer treatment. And this kind of, you can search for different medications, and they give you a lot of different side effects that can occur as a result of using those types of treatments. So I thought that this chemocare.org website was very helpful, like I said, even from a clinical standpoint. And any of these changes can occur during treatment or following the completion of treatment. So I found an article, just a research article, again, not the most recent, but something that I found very interesting, just kind of talking about how long we expect chemotherapies, or how long we can expect these effects to kick in or to sometimes last. So initially, research was showing that individuals experience short-term cognitive changes which were occurring as a result of the physical toll that chemotherapy has on the body. Kind of fast forward a little bit, and we have a research study that uses a popular model called the Morris-Water maze that did a little bit of research in female mice to kind of mimic postmenopausal women for the purpose of the study. So their goal with this was to measure the potential long-term effects of chemobrain. They measured, one, how chemotherapy impacted learning and memory, and then they also charted information about neurons in the hippocampus. So the hippocampus is a part of our brain that's really important for cognitive function, especially memory. It does have some other roles, but it is a large component of our memory. So with this model, mice were placed in a circular pool and timed while they searched for a certain submerged platform within the pool. So what their findings were from this study were that mice subject to chemotherapy actually took longer to learn the task itself. Then looking at some of the neural changes in the hippocampus, 26% fewer surviving hippocampal neurons were created during the treatment, and 14% fewer hippocampal neurons were noted 3 months following the treatment. So in this article, it kind of explained that, in comparing this 3 months in a mouse corresponds to 10 years of life in adult humans, kind of indicating that chemotherapy can lead to these long-term deficits, cognitive deficits in the chemo brain. It's still important to consider, while one can experience brain fog as a result of the chemotherapy, cancer, and the different treatments, that there are many other common issues that can really affect our thinking and our brain function. And these things can also be exacerbated following treatment. So these factors that I've listed here and that we're going to discuss can have the short-term or long-term effects, temporary or long-term effects, depending on management and severity. So to begin, we have blood pressure. And with blood pressure, we have hyper or hypotension, which can impact our ability to focus, retain information, and think. So proper managing is really important if blood pressure is an issue or a potential issue. Modifications to medications can improve our mental clarity and our focus, and thus improve our recall. However, some of these medications also, like I mentioned before, can kind of do the opposite and cause more difficulty depending on the medication. Sleep is very important for all of us, but if you don't have enough sleep, you can wake up tired and fatigued, which can affect your attention and focus. And we usually recommend, within a clinical environment, I a lot of times will talk to my own patients about trying to get in a better sleep routine. So going to bed around the same time, waking up around the same time, aiming for that 7 to 9 hours. I know sometimes that's hard, but ideally aiming for that 7 to 9 hours, and really trying to eliminate blue light emitting devices prior to bed for about an hour prior to bed. So those are things like your computer, iPad, telephone, things like that. And what happens is those blue light emitting devices actually keep your brain stimulated. So you might feel as though you're not doing anything that involves a lot of thinking, but simply just looking at those screens it can keep your brain stimulated and have a hard time with winding down. Health and hydration, as well as regular activity and movement, are very important for our thinking, as our stress, mood, emotional changes, which can exacerbate our cognitive symptoms. So it's really important to help with that management as well. Hormonal changes are things that are, going back to the stress part, I also like to reinforce a lot of times how important self-care is throughout all of this. And self-care looks different for everybody. Some people prefer to do more of a formal counseling route. Other people, and I talk about this a lot of times with my own clients, just that regular exercise is helpful. Finding time in the day to deep breathe or incorporate some mindfulness exercises can be really important. So when it comes to the stress and the emotional toll that this can take, it is really important to find what works best for you. Okay. So now you may be asking yourself, or you might be identifying or have been identifying different areas or changes that you have noticed over the course of treatment, in the years following treatment. And some of the things that you might have experienced, I have listed here. And this will tie into a little bit what we'll talk about later with the cognitive therapy. So you might experience changes in attention, reasoning, problem solving, and what we call executive functioning, initiating tasks, setting goals, planning, again, memory, difficulty with word finding, difficulty with social communication, and delays in processing. So we're going to go into each one of these a little bit more specifically, but just kind of as an overview, I wanted to touch base. So with attention, and actually I want to back up as well. A lot of these we have talked about in prior sessions too, and gone a little bit more in depth. So if you have any questions or any more information or need any more information, I would be happy to answer questions at the end. But we also have information in prior presentations going a little bit more in depth into these topics. So to start with attention involves our ability to multitask, concentrate, and alternate our attention between different things. There are a lot of different levels of attention, and at times it might feel as though we're able to attend to a movie or a TV show without any difficulty. But when we're challenged with multitasking, talking on the phone while cooking, for example, or focusing while there's a distraction, that can be a little bit more challenging. Reasoning, problem solving, and executive functioning can be affected. One may experience difficulty with evaluating appropriate choices to complete tasks safely. For example, if there's an object out of reach, is there an appropriate way to obtain it without causing any injury? Then we have planning and organization, which can be difficult, and it can become effortful to self-evaluate our work and our performance. So for example, if experiencing difficulty with planning and organization, one might have a hard time with planning their day, looking ahead into the week, allowing appropriate amounts of time to complete certain tasks, and so on. Memory can be affected, including our orientation, the date, time of day, things like that. It can affect our ability to recall appointments, people's names, and events. Word finding and social communication can cause difficulty with just communication in general. However, sometimes the difficulty with word finding that one might experience and that we talked about a lot in our prior presentation is more associated with memory and attention memory, attention, or processing versus language itself. And as mentioned, delays in processing can be affected. So this becomes important in situations where you're obtaining information visually, like reading, or verbally in a conversation, and you might require more time to read or to understand what somebody is saying. This becomes more problematic if somebody has moved on to the second or third point of conversation, but you're still processing the first. In this situation, then information is missed. Also similar to this presentation, if I move on to a slide and you're still trying to think about this slide, information in the meantime might be missed. So how to seek help? The first step with this would be to visit your doctor. But I think, with doing a lot of these presentations and Jen doing such a great job and the cancer carings that are doing such a great job, it's, our goal also is to be able to reach more people who need help. And that's also why I'm here today. So visiting with your doctor is helpful, but you also want to share any concerns. So as you attend these different groups and meetings, you might be aware of different changes and know that there is help. When you go, make sure you tell them all of your symptoms and give information about your medications, and also tell doctors about your habits, because it's important for them to know, the right referral source, the right person to get you to help. So you may be asking yourself, if you've never been in one of these presentations, what is speech therapy? Speech therapy offers more than it sounds. Yes, we do, as speech language pathologists, address articulation, stuttering and fluency, and voice. But we also, a lot of times, especially following head and neck cancers and different types of treatments, will focus a lot on cognitive communication as well as swallowing function. So how do you get started? If this is something that you might be interested in, again, I'm here to help kind of guide you through the process. But what we would do is receive a referral. So this can come from your PCP, this can come from an oncologist, whomever you feel, would be the best, the physician that knows you the best, I think, to make that referral, although it can come from anybody on your team. And what we would do is start our therapy by doing an initial evaluation to start and establish kind of a baseline, our starting point for where we're at with speech, with language, with swallowing, with cognition, whatever the primary complaints are. And then it's important to work with your therapist to develop a care plan that's important for your own goals and your own needs. I personally prefer to work on specific goals that individuals might have. So for me, this is a really important part of the care plan. We have lots of activities and tasks and websites and apps, which we'll talk a little bit about, that we incorporate, but it's also really important for your providers to know what you want out of therapy and what your goals are. For some people, that's simply learning how to use their phone better, because that can be a very good resource and a very good cognitive tool. Other people might have trouble with managing their medications or their finances, and so we work on goals to address those specific complaints. So our goal, for cognitive therapy, as I kind of again listed some of the primary things that we might address, is to really provide education, strategies, exercises to improve areas of impairment, but also to improve overall function, safety, and quality of life. As mentioned, primary changes following chemotherapy, radiation, and cancer can include these areas. And so it's really important to consider these in how they're affecting day to day. Once therapy is initiated, our goal is the real work continues. So we often provide what we call home exercise programs, even though there's not necessarily a physical exercise, like that you might do in physical therapy. But we a lot of times will develop a home practice and home programs to help carry over things from therapy into an actual functional setting. Kind of going back to functional goals, I've had patients that will bring in their own bills, and we work on organizing and coming up with a plan to address them and to do it efficiently and accurately. And then part of their program at home is to carry that over from therapy to their home environment and continue to pay and manage their bills and finances. So when it comes to strategies, a lot of times we use the term I travel to talk about different strategies and different tools that can help. I've had a lot of patients kind of tell me that the fogginess that they might experience as part of the chemo brain, or just the brain fog, kind of feels like there's just things floating around in their head, like letters in alphabet soup, just kind of floating around. And they're really trying to put the pieces together. And so these strategies can help. The first one, I, stands for immediacy. And it's exactly what it sounds like. If you do things as they come up, then you don't even need to think about it later. But another important part of that might be to write it down right away. We can't always drop everything in that moment just to do something right away. T stands for tools, excuse me, and that's anything that takes over our memory for us. So getting it out of our head and getting it somewhere else. Tools are great because if we remember it, great. If we don't, there's a backup plan. And we all do these things. We set alarms, use calendars or planners or notes on the refrigerator. But sometimes it's hard to do those things consistently. And that's where therapy might help in coming up with better tools, better strategies. R stands for routine. And that basically means that the more automatic you can make things, the better. Keeping things in the same spot at home, remembering your medications by trying to really make an effort to take them at certain meals of the day. You eat your breakfast, you take your pills. You eat your lunch, you take your pills. You brush your teeth, you take your pills. Establishing that type of routine can really kind of help to compensate for areas that you might have more difficulty with when you're feeling a little bit of that brain fog. A stands for association, and that basically means that you pair or group things together to help yourself remember. I tell everybody, or my own patients, I don't care how you remember things, it doesn't have to make sense to anybody else. But if it makes sense to you, that's all that matters. If it makes sense to you and it's helpful for you, that's all that matters to me. So association, you can come up with the most off the wall way to remember something, but if it helps you, that's fantastic. V stands for visual imagery, or I call it visualization. So forming a mental picture in your mind to help yourself remember. For example, walking into a room and not remembering why. I know, when that happens to me, I try to think about, okay, what was I doing when that thought popped up in my head? Or I was in the kitchen, what was I going to do? Oh, I ran out of salt. I need to go to the pantry and get salt. So kind of visualizing things in your head can be helpful. E stands for environmental rearrangement. And this means that we move things around in our environment to remind ourselves to do something. So that can be putting a note on the door so that you see it on the way out and it reminds you to grab something before you leave. It can be putting something by the door physically so that you see it and it reminds you to take it. Really anything that you do to remind yourself to do something by altering your environment. And the last strategy on here, L, isn't necessarily a strategy. I guess it kind of is, but L stands for listen and attend. So we have to be able to attend and listen to things in order to remember. Now, getting a little bit more specific, I'll go a little bit slower in case you want to jot any of these strategies down, but these are some specific strategies that you might experience or might find helpful given any of the impairments that we're going to talk about as a result of chemo brain, the fogginess, and the treatments. So first we have attention and concentration. Sometimes I'll suggest using a timer or an alarm for a specific period of time. And this can be helpful for a few reasons. I had a patient at one point that actually told me it was suggested by a counselor, I believe, to set a timer. Well, let me backtrack. To help with focus while doing a specific task at one time. So they were instructed to set a timer for 5 minutes, work on that task for 5 minutes. When that timer goes off, if they're done, they can move on to something else. But if they're not done, reset that timer and kind of keep in that pattern until the task is complete. I know it's hard sometimes to focus on one thing at a time, and that's what using a timer is for. And kind of the opposite, sometimes people become very hyper focused, and so alarms are helpful for remembering to take a break. Our minds are like our body, and it needs breaks sometimes. So sometimes people benefit from setting an alarm to actually step away. It can be very helpful to organize or pick an environment that really helps to facilitate attention. I sometimes, if I'm doing work or trying to read at night, and I'm doing it in the basement where there's a lot of things that need to be done down here, it's easier for me to get distracted than to just focus on my reading or my work. So picking an environment that helps kind of facilitate attention can be great. For orientation, you can use a daily schedule or a planner. And these can be written or like assistive technology, which is just any of our typical technology, like our phone apps, reminders, calendars, things like that. I usually recommend this, picking one or the other, or if you're going to also use written notes and reminders, also make sure you're diligent about putting them in your phone. Sometimes what happens is when we have notes in too many different places and we don't consolidate them, it can be a little bit more confusing. I am also guilty of that, so that's okay. But trying to modify and figure out what works for you is something a therapist can help with, or that you can try yourself as well. It might be helpful to use a daily journal and record events of the day. I will often encourage people to do that, especially, if it's bothersome to forget little things that happen throughout the day. You don't have to write every single detail, but sometimes people have a hard time remembering what they ate at meals. So I suggest they keep a journal to write things like that down. If they talked on the phone, if they went to the store, little things like that. And part of that also goes into attention. So we sometimes these little moments pass by through the day that we want to remember, but it's kind of hard to do it because we don't actively think about it. We just kind of go through the motions. So sometimes it is helpful to add these little pieces of our day into an actual, written form in a notebook or a journal or something like that. And this might help actually with this last strategy of setting anchor points or events during the week, and then attempt to kind of reconstruct previous or subsequent points in time. So maybe if like Wednesdays might be a good idea, a good time to think about what you did Monday and Tuesday, and then what you plan to do on Thursday and Friday, or even doing that on Sunday. So setting different points during the week to help kind of reflect. Next, we have some comprehension and some memory strategies. Again, feel free to write these down. But one of the things, especially for comprehension, that's helpful is to use self-questioning. So ask yourself, do I understand? Do I need to ask a question? If you do, you might be able to write that down. Kind of always be thinking about what's going on in a conversation or what you're reading or things like that. Just depending on what your needs are, you might need a study guide for extended material, like if you have to, read a research article, or you're doing something for work, or if you're, school aged, using a study guide for extended materials can be helpful. Periodically look for what we call GMCs, which are gaps, misconceptions, or confusions, which kind of goes back to the self-questioning, and kind of thinking about, do I understand that correctly? Is there anything that I'm confused about? And kind of intermittently check. Use external aids like recorded materials, logbooks, notes, memos, anything like that. These external memory aids get things out of your head and somewhere else, like our tools. And then also I travel can be very helpful. For word retrieval, I think this was one of the bigger topics maybe last month or the month before. But it might be helpful, and a strategy that you can use is to think about various categories or subcategories for an object. For example, if you're trying to think about a person, trying to think, okay, they're my family, they're my immediate family, oh, that's my sister. It can be helpful to, and we use the term circumlocute or circumlocution, which basically means to talk around it. So describe the concept. What's it look like? What's it taste like? Where do you find it? Is it something that, does it remind you of anything? I always quickly go to the example of a remote control, but thinking about if I couldn't come up with that word, I could say, oh, it's that thing that you use to turn the TV on. It can change the volume and change the channel. Oh, the remote, right? So it can help you come up with a word, or lets the person that you're conversing with know what you're talking about. You can search for initial letters and sounds of the alphabet can be helpful strategies and triggers. Visualize and associate with different pictures in your mind. Pointing, drawing, and gesturing, and thinking of the opposite of the word can be helpful. For thought organization, you can construct a timeline. If you need to, you can physically write a timeline or a sequence of events to help with organizing things in your mind. It also gets it out of your head and onto paper or a computer or wherever. Make sure that you note the topic of a conversation so that, and you might have to do periodic checks. Are we still on the same topic? Has the topic switched? Do I need to switch what I'm thinking about? And watching for others for feedback can be very helpful. If you're wondering if your words are confusing or if you're confusing things, kind of getting some feedback from the person that you're talking with or individuals you're talking with can be very helpful. So for organization, it could be helpful to use checklists, prepare a workspace, just depending on the task that you have and what demands. Is it a space that you're going to need a lot of room? Maybe it's not best to do it on the kitchen table. Maybe we need to spread information out all over the floor. Or just kind of making sure that the space that you're working in fits what you're doing. For reasoning and problem solving and judgment, using self-questioning and looking for all the other alternatives or consequences can be helpful. Look for possible solutions and try to provide two different perspectives. And then also a technique that I like to use called plan, prepare, and go, which basically means that you have your goal that you want to achieve. You come up with a plan, or several plans, decide which one is the best, prepare and execute the task, which is go. After that, you can come back to the task and kind of evaluate, was it effective? Was my technique effective? Was it not? And then you can kind of change your plan for the next time. Using for self-monitoring also, you can use symbols or signs, put them in places or alarms that might remind you to pause or stop. Again, going back to the alarm for taking breaks or trying to sustain attention longer, and kind of double checking with yourself, am I doing what I should be doing? It can be helpful to use a book with cards in certain different, inserted in selected places, that can also help with self-monitoring and different cues. So for example, placing a card and saying, summarize what you've read, or who are the main characters in this book, things like that. There are some general apps and websites that we will use a lot of in therapy, but I always tell people, there is no research out there that says buying into a program is going to get you X, Y, and Z results. So there's plenty of free stuff out there, and feel free to use those resources. Talk Path Therapy is from a company called Lingraphica, and I don't have any association with these companies, but these are just things that I tend to gravitate towards for therapy. Talk Path Therapy is a completely free app. It has a range of cognitive and language, swallowing, a little bit of everything, speech, tasks that you can kind of change the complexity, and it monitors your progress, and it's totally free, which is nice. Lumosity, you've probably seen or heard commercials for this. They do have a free version of their app, and I usually, like I said, just recommend doing the free version. You don't have to, I don't even know what the fee is, but you don't have to buy into a program to get those results. So they offer, I think, 3 free games every day, and they change every day. They might revisit at some point, but generally they give you 3 free games every day. Some websites that I really like are memory improvement tips.com, braincorals.com, and with a membership, aarp.org has some great cognitive games. There's a big variety from what I remember, and quite a few that are very challenging too. So they have a really good brain game section if you have a membership. If apps and websites aren't really your thing, there are a lot of cognitive activities that you can do for home practice. The important thing, which I'm going to kind of jump to the very last point, but is keeping your brain stimulated. So functionally, use strategies, use tools every day, practice orientation or multiple times throughout the day. Try doing it without a calendar, but if you need it, use the calendar. I don't know sometimes what the day is unless I look at my watch or my phone. Give yourself more structure in the day. I think as humans, we really do benefit from more structure than we realize. So that could mean assigning chores to certain, or household tasks to certain days of the week. You're trying to schedule certain games or activities or at certain times, things like that. You can watch the news, read the newspaper, read magazines, and discuss important facts. Making to-do lists can be helpful. And learning something new can be great. This can also be a good opportunity to find a new hobby or try something you've always wanted to try. It's very good for cognitive stimulation. And so it can be very good. I know a lot of women have a lot of patients of mine have tried to get into like crocheting and different things like that, but it's challenging, and it's physically good too for fine motor skills. So learning something new is great. It's always important. I know it's hard now to stay active socially and really try to engage for daily for enjoyment and for just like social function. And there are a lot of card games, board games, puzzles, things like that all have some type of, can have some type of cognitive benefit, whether that's learning a strategy, remembering the rules, keeping a score, having to pay attention, taking turns. There's really a lot of opportunity for cognitive activities, even inside your home. Okay, so I want to thank everybody for jumping on today, and we'll in a minute get to some questions and comments, but also feel free to contact me. I work at the Lemieux Sports Complex in Cranberry, so I'd be happy to help out with anything. And Jen has been really great too at filtering questions my way, if they get to her. But that kind of wraps up everything for today, and we will send it over to Jen.
I'm muted, and I
Okay.
trying to get this worked out. I am going to stop the recording so everyone can just ask their questions in privacy. So hold on for 1 second.